How to prevent CF cross-infection from droplet transmission. Imagine a world where tiny droplets from coughing or sneezing can carry harmful germs from one person to another. In cystic fibrosis care, stopping these droplets from spreading is vital to protect everyone's health. To do this, we follow strict infection control steps that focus on reducing the risk of respiratory secretions passing between individuals with CF. First, maintaining physical distance is key. Patients should stay at least 3 to 6 feet apart in clinics, hospitals, or social settings. This distance helps prevent droplets from reaching others, as respiratory droplets generally don't travel beyond this range. Keeping this space reduces the chance of infection spreading during interactions. Next, proper containment of respiratory secretions is essential. People with CF should be encouraged to cover their mouth and nose with tissues when coughing or sneezing. These tissues should be discarded immediately into a lined trash bin to prevent contamination. It's also important to avoid touching others with contaminated hands, which can transfer germs unknowingly. Wearing masks is another critical measure. Masks act as a barrier, blocking respiratory droplets from escaping into the air. Patients should wear masks when entering healthcare facilities and keep them on until they are in an isolated exam room. In public areas within clinics or hospitals, masks help protect both the wearer and others from potential transmission. Hand hygiene cannot be overstated. Washing hands thoroughly with soap and water for at least 20 seconds or using alcohol-based hand sanitizers helps remove germs from the skin. Everyone involved in CF care, patients, family members, and healthcare workers, should practice good hand hygiene after touching respiratory secretions or contaminated surfaces. Healthcare providers follow standard precautions, including wearing personal protective equipment and practicing transmission-based precautions such as contact and droplet precautions. These protocols help prevent the spread of bacteria like Pseudomonas aeruginosa, Burkholderia cepacia complex, and Staphylococcus aureus, including methicillin-resistant strains. Cleaning and disinfecting are also vital. Respiratory therapy equipment and frequently touched surfaces like doorknobs and tables should be cleaned regularly with hospital-grade disinfectants. This reduces the chance of indirect transmission through contaminated objects or surfaces. Patients should avoid sharing personal items such as medical equipment, toys, books, or other belongings that could harbor germs. In clinics, bringing personal items from home is recommended to minimize exposure to communal items that might carry pathogens. Many CF centers implement isolation policies. These policies restrict attendance or close contact among patients colonized with high-risk bacteria like Burkholderia cepacia or methicillin-resistant Staphylococcus aureus. Such measures help prevent cross-infection among vulnerable individuals. Finally, ongoing education for patients, families, and healthcare workers is crucial. Staying informed about infection control practices and collaborating with infection prevention teams ensures these protocols are followed consistently and effectively. In summary, preventing droplet transmission in cystic fibrosis involves a combination of physical distancing, respiratory hygiene, mask use, thorough hand washing, environmental cleaning, and strict infection control policies. These steps work together to protect this vulnerable population from serious infections caused by respiratory pathogens. Always remember, for personalized advice and the best care, consult healthcare professionals who can tailor these measures to individual needs.